I feel like I've always wanted to be a nurse since I was in kindergarten, and they ask you what you want to be when you grow up. Everybody was saying doctor, fireman, doctor, police officer, doctor, and I was like, oh, there's so many doctors, we're gonna need nurses. I was partially raised by my great-grandmother, who was an unofficial nurse in Mexico, a partera, so she would help deliver women and animals. My specialty in labor and delivery is RTS. I'm RTS certified, means resolve through sharing. I handle all the fetal demise cases, which is really near and dear to my heart. And so those cases are ones that are very, very impactful, and those babies are babies that I will never forget. And those are the names that I hold on to. You know, I had a mother who tried really, really, really hard to have a baby. She had 6 losses. And the 6th one happened to be the case that I was working with her on. And she was having twin boys, Jax and Luke. They were 21 weeks. The babies survived for about 3 hours and then passed away. I did everything that I would have wanted somebody to do for me. And it was just so impactful because weeks later, I got a letter from her thanking me. And who does that? Who loses a child and then thanks somebody for helping them through it? And I hold on to that letter because those little boys I'll never forget.
I came here to the White Memorial when I was pretty young. I was looking for a job. It was like after high school, did a 1 year of college. I actually got married and had a baby. I had to put school on hold and decided that I had to, get a job. And this job was like a hospital operator, answering phones, transferring calls. And I did that for 10 years. My goal was to continue to go back to school. I had gotten an associate's degree, so now I wanted to have a bachelor's degree. When I was going into nursing school, I already had my 3 girls, and they were very young. So it was very, very hard. It was a lot of sacrifice. And in 2015, I got my master's degree with a focus on education. One of my favorite things as a manager or director is really going to visit with patients. This community is, the Hispanic community majority. We can connect because we come from the same maybe background. I have been involved with the Telemetry program. What they do is go out to the community, the colleges, and really support the Hispanic nurses who are interested in serving their own community. There's a lot of great stories that we hear. It just reminds me of my story, how I started, and the struggles I had to put myself through when I was in school. It's an event that for the last 5 years I've been participating in, and I just love it.
I was part of the Rio Hondo College ADN program, and through there I was awarded a scholarship through Telecu. They work with the Latino community and they help out any Latino students that they can in the education program, but they also want to bring in Latino nurses to a community that really need people that can speak and relate to the culture. Being a new nurse is a challenge in itself. Like I said, you don't have the experience to back up all the knowledge you just came out of school with, but you do have a drive. You have a drive to learn, you have a drive to bring your practice now to real life. And if I could tell myself a year ago or even 3 years ago that I would be here today, I don't think I would have believed it. Just get yourself through those challenges. Those challenges, yeah, they make you a little bit thicker and stronger, but you learn from it and then you grow from it. And that's the best thing that's happened so far. My journey into NICU started when I was a volunteer at Glendale Adventist. And while I was a volunteer there was a mom that abandoned a baby. And every nurse that could would stop by and take care of that baby or carry it, do something for that baby. But it was when the NICU came for that baby that just made me feel like, wow, like I want to be that. In the NICU, we actually get a very special opportunity where we get to spend a lot of time with our patients. And most of the time they can be here from, anywhere from 2-3 days to months. We bond with them. We also take care of them around the clock, so we also get to be that extra family member that they don't have. So when they grow up and they're okay and they get to go home, it's awesome. We all celebrate it. We do a NICU graduation and they go home and then they come back and visit us when they're big and chubby.
I'm from the community. I was born and raised in East LA. So I always saw that none of my family members ever went to the doctor. There was always that mistrust with healthcare there, but I saw that they were sick. So I knew I wanted to do something about that. I knew that this is the only hospital I wanted to work at. This is where I grew up, this is where I volunteered. When I was in nursing school, I would come and do my clinical hours here. I remember the first time I had to put an IV. This was in nursing school still. Back then, the catheters were made is if you didn't put pressure, blood would just gush out. Nowadays, they have like a valve that doesn't allow that to happen. And I remember I was putting in, they always say, put pressure, and I forgot. And I kind of just froze. But I understood, like, when you're under pressure, like, just stay calm, and, you being nervous is only gonna make the situation worse. It's a certain type of patients that I get, which is the Hispanic or Latino community. I tell them, do they prefer to speak English or Spanish? They ask, I have the option. So that always sticks out to me because I think it's something that some people take for granted, that you can communicate with someone.
I'm from Peru. I came when I was 17, and it has been a long journey for me to get where I am. My grandfather, he was a diabetic, and at one point in his life, he fell down and he broke his hip. I saw his suffering, I saw the way that the disease process was taken into him. Since then, I said, I want to become somebody to help other people. Nursing is very complex. We need to understand that we are taking care of a human being. And a human being is not only the body, but you have to have in consideration their beliefs, the way they think, their culture. As Hispanic, I understand a little bit more my Hispanic culture, and I try to understand why they don't do certain stuff, and that's when I teach them and educate them. I won the Daisy Award back in December of 2017. This patient was very anxious because we were trying to rule out a stroke. I remember going into detail, explaining to the patient and the family and asking questions back to see if they understood what I was teaching them. I'm really grateful because every time I come to work, they say thank you to me. All my patients are very, very grateful of what I do. Just with that simple gesture of thank you or bringing you some fruit. I have a lot of people bringing me food, and I'll be like, oh no, you don't have to. As you work hard to make them feel good and better, and this vulnerable time that they're going through, they're making you feel as well as special.
As a young girl, I always wanted to be able to take care of people, to help people. A train crashed in my town. I heard that. And I said, okay, this is my opportunity to see if I can do it, if I'm brave enough to take care of sick people, injured people. So I went to the scene, and I see people bleeding, and I help. And I did it, and I said, okay, this is it. I'm in it. I'm from South America, I'm from Peru, and I went there to nursing school, and I'm registered nurse for 49 years. When I bring to the table as educator, it's not just the books, it's the experience. Because every patient is different. I remember we went to this room, a young mom, also that was dying of cancer. When Dr. Ismael asked the husband what was that he would like to see, on his wife, and he says, just to wake up. But she was in a coma. She wasn't gonna wake up ever. Now, when he got, oh my goodness, it makes me sad too. When he got to the daughter, sorry. When he got to the daughter, said, I said, what do you want your mom? And she says, to wake up. And I just want to tell her how much I love her. So I hug her and we cry. All of us cry. We're human. We also feel the pain. We feel the suffering. And I had a lot of fun with my patients also. I remember this gentleman had an amputation, from his knee down. And then he calls me, Rash, come over fast, come over, Amadita, run. And I ran and says, please scratch my left toes. And I went, he had no toes. He was laughing, cracking up, so we laughed, he hugged me, I hugged him. We were just laughing. We had to have positive attitude in every way. And thank God, the positive attitude is contagious.
I knew I wanted to help people, whatever that realm was, when I was a young mom. So I knew I wanted to do more very quickly. Adventist Health White Memorial, a unique place in itself. It's the family, it's the love, it's the compassion, really wanting to do good for the community. Our community remembers us. You go down to go get some tortas, and you see the patient's sister, and you have a reminiscing story. But it's the community we serve, and our coworkers, and just those connections. When I was a young mom, I took her to an emergency department. She started vomiting and she was just a fever. She couldn't come down. I mean like 103, and she wasn't going down. I've tried Tylenol, Motrin, all the tools that a mom has, right? I remember feeling an immense sense of guilt, going there and holding her in my hands and taking her through the emergency department and kind of getting laughed at. The comment to me was, "Oh, are her legs broken?" And I thought to myself, no. She's just really sick and I just feel vulnerable and I can't take care of her and I'm her mom and I really have to ask for help now. The reason why it stands out was I never wanted a mom to feel that way again. Quality of nursing care from a patient perspective is they're expecting us to do a really good assessment, expecting us to give meds on time. All the things, the tasks that we look at, they're expecting quality care. So what a patient experience or what a patient appreciates from the nursing side is the compassion.
My name is Brian Johnston. I'm an emergency physician. I've been at this hospital since 1975. In 1995, I was hospitalized for 4 days in this hospital with a kidney stone, and it wouldn't pass. In the middle of the night, a nurse came up to me, came up to my bedside and took my hand and said, "May I pray with you?" And she took my hand and she prayed. I've never forgotten her voice, and I have never forgotten her prayer. It brought home to me that care is one person to another person. I think the hospital is dedicated to improving care and quality of care. And when we don't do things quite right, we learn how to do them better. There's a sense of family here. And we are truly a team. If someone comes up to me and suggests a way to do something better, I will listen. I have had nurses see things that I didn't see. And I can think of patients whose lives were saved.
When I turned 26, I decided to go back to school and become a nurse. And I've been a nurse for 10 years. Most of my clinicals were done at Adventist Health. I am a Spanish speaker. That is my first language. My parents only speak Spanish, and so I love the community we serve. Last year, an opportunity came up for this new position called Stat RN, as well as being the first responder for Code Blues and rapid response. We also try to do early intervention by identifying patients that are of high acuity. I've had many opportunities, many losses as well, with patients that I've become close to. I felt like I've helped someone during their most vulnerable moment, whether they just got diagnosed with cancer or being there for the family in case somebody passes. That's when they need you the most. And in nursing is one of the positions where you are allowed to cross that line and offer an embrace.
I went into nursing because my mom actually was in and out of a hospital for quite a few years. The nurses that really cared for her and were really passionate about their job, you really could tell that they made a difference in her life. Unfortunately, my mom passed away, and truthfully, for a long time, I didn't want to go inside a hospital. It took me a long time. I actually gave birth to my first daughter. That actually ignited that passion that I had for it. So that's when I decided to go to school. I have an associate degree, and so I'm going back to school for a bachelor's degree. And now I have 2 little girls at home, not just one. So it's not the easiest, but it's just something that I have to do for myself. We are predominantly Spanish speaking, so walking to a room and speaking to the patients in their primary language and seeing how much they appreciate it and the reaction of their face when you speak their language, that always sticks out to me. From a very young age, my parents instilled that everybody is important and everybody matters. Everybody deserves the best care that they can possibly get and that you can possibly offer to them.
I kind of fell into nursing by mistake, by accident. I was a psychology major in college, and after a couple years started realizing that I wasn't really sure where I was going with that, what I would do once I graduated. So I started looking into nursing. I started as a pediatric nurse and then a NICU nurse, and it's not that I didn't like that, but I think it just wasn't me. And I think it took me, 13, 14 years to find my place that I feel the most comfortable and that I feel like I can shine and really do the most good. Welcome Baby is a home visitation program. I visit moms within 2 weeks after they've been discharged from the hospital after they've just had a baby. I talk to moms about the transition to motherhood. What I really like about that is, as a mother to myself who had my own challenges after having a baby, I feel like it's very much needed in the community and very much appreciated by the women that I visit. I had a client recently that had a lot of challenges. She had had a traumatic birth where she thought she was going to die. It wasn't so much the nursing, like pathophysiology or any of the medical stuff. It was more just she needed someone to hear her out and give her that space to talk about it. You could be the best clinician in the world, but if you're not there to hear them and see them as a person who's struggling with something difficult, then you're not being a good nurse. I think that's really the most important thing.
Back in my country, I was in med school. Then I came here and I decided to go into nursing. I applied to this hospital the same day that I applied, I got hired. For me, I felt like they made me part of their family that day. I love the interaction with my patients, that we can make a change on someone's life. One patient that was already in his last days, the wife at the beginning was complaining about the nurses and the staff. I spoke to the wife, and then to find out that she was really going through the stages of losing her husband. And I told her, you can call me at any time. I showed her what my office was. So the next day she came to my office, and the wife, after we did everything, she was really happy, and she even brought donuts to the nurses. So she was happy with our care after. So we always have to find out what the cause is of patient or family's behavior, because it's not always that the nurses are doing something wrong. It's that they worry about a lot of things, and we just need to listen to them.
I went into nursing because I always wanted to be part of the medical field. I was in the Army before becoming a nurse and going to nursing school. So I was an infantry officer. Did some cool things. Went to Ranger School, went to Iraq in 2005. On my last duty station, I was in San Diego with the Wounded Warriors. So I got to help transition soldiers who were coming back from Iraq, Afghanistan, severely injured. So I wanted to do something in the medical field. Started nursing school and excelled and enjoyed, and here I am today, still doing what I love. After graduating the Versant program, I started on my own. That was probably the scariest month of my life. Probably got a few gray hairs, my stomach issues started and nerves, but eventually, you conquer that. In the ICU, there are life and death situations. Getting the right medication, the right procedure, sometimes even advocating for your patients to make sure that the right thing is done, the safe thing is done. What I've enjoyed is where someone comes in that is non-responsive or medical-induced coma or whatever the case is, and then they walk out of here, get out of the ICU. So those are the great examples of where the medicine works, the procedures and whatever was done helps improve the patient.
I went into nursing because one of my children had an open heart surgery as a newborn, and it inspired me to help others. One of the biggest challenges is meeting all the documentation expectations that we have, because at Nursing 101, it's if you didn't chart it, it never happened. So it's really painting the picture of everything that we've done for our patients on a computer. We had a patient come in that was in full arrest. To see everybody just kind of take care of this patient like if it was their family member, and to see the patient, despite everything we did, that eventually that patient ended up dying. It's very heartbreaking to see my coworkers suffer and grieve for this patient. It's a reminder that, we're all human, we're all here, and we need to take care of each other and take care of the people that, we serve in this community. I always joke around that I'm getting older, so I have to stretch now because we do have to go from 0 to 60 sometimes. That's the most important thing. You have to take care of yourself before you can take care of others. It's very difficult to take care of others when you're hangry. You gotta feed yourself, you gotta stretch a little, and you gotta breathe.
I do meditation. I make sure that I eat as well as I can, that I exercise, that I come to work when I feel healthy so that I can be an asset to the patients. I love helping people. I love helping this community. I grew up in this community. So for me, it's important to give back. I started as an LVN and then I became a registered nurse and was connected with Teleku, who helped me finish my second year of nursing school. It was amazing. It's financially very helpful, especially on a second year. I was a single mom and I have 3 girls. My middle child wants to be a veterinarian, so she said if she doesn't or isn't able to follow through with that, maybe she'll do nursing. My very first patient that I ever had, I was a student here. The patient had been in a motor vehicle accident. I think he was in his 90s. I was able to see him go from not doing well to doing really well, and that was very impactful for me. I knew I was in the right career. Some of the challenges are definitely the 12-hour shifts, how busy and how responsible we nurses are now becoming, how much we have to know, the physician side and then the nursing side.
I'm so sorry. Gladys, 53-1 is Taffy.
Okay. Yeah, I'll be there in a minute. Okay. That's nursing, yeah.
What do I love about nursing? It's too many things to really count, to be honest. I get to come to work and it doesn't feel like work. I get to meet so many different people, whether it's an associate or whether it's a patient or patient families, the stories I get to hear, the things I get to witness. School was a challenge. It's, sleepless nights and also with work, long hours sometimes in my role. I was getting my associate's degree in nursing and we had our pediatric rotation, and I've always loved kids, but there was this one little boy that was in the hospital for months. He was always smiling, like no matter what. He probably was in pain most days, but he was always smiling, and I just remember having the privilege of being able to take him in his little wagon around the unit, and it's just was sad at the same time because I never saw his parents. Not to say that they weren't there, but parents have to work, and they're trying to support their kid who's an infant being in the hospital, and the nurses are sort of the parental role at that point. The way he was able to adapt was amazing to me, and I will never forget his little face. I always think about that on a bad day,
When I first started growing up, I wanted to be a firefighter, so I became an EMT for that, emergency medical technician. That's what got me into medicine. After that, I decided to go into nursing. I feel like nursing, you get to spend more time with the patients, so you get to connect a little more. When I was an EMT, I didn't have the chance to do that. I would just treat them and send them to the hospital. In the ER, you see people from different ages, different diseases. Communication is a big part of it, not only with your team, your nurses and your doctors, but also with the patient. Especially in the ER, they come in and you kind of have to find out their stories. So just be able to talk to them and the way that you can connect with them, they're actually gonna tell you more of what you need to know. An experience that sticks out to me, it's a burn patient I had here. Even though we're not a burn center, they brought in a patient, like in the ER you get anything. It was very traumatic for me. The patient didn't make it, but I feel like those moments, it's very important for you to have a support system. For me, it's my family, so that's something that I went home and talked about and kind of got through it, because stuff like that, you just think about life and anything can happen anytime,
A reason that I selected White Memorial was because when I came here as a nursing student back in the 1970s, I went to maternity. I happened to be in orientation when they rang these little bells, let mothers know it's time to wash their hands. Then they would come around the nursing station and pray for the doctors and nurses and the patients. And that captured me, and that's why I put my application here at the White. I came across a school that's only 2 blocks away called 2nd Street Elementary School. This opportunity gave me to step into the school and actually adopt a school through the hospital's gateway. And this is my 3rd year. It was my highest backpack giveaway of 78, so 78 children were able to get all the supplies they needed. Right now, the older generation, and I really influence the students when they come, because I told them, when I'm also ready to leave, they're going to take my place. So I educate them to let them understand that they need to be as good as me or better than me.
My name is Eva Myers, nurse practitioner, and I'm currently the coordinator for our cancer detection program here at Adventist Health White Memorial. We had one cancer patient diagnosed with a very aggressive form of breast cancer at a young age, approximately age 50. 4 years later, she found herself with a stage 4 breast cancer, and she was really kind of at the end of life. I was able to inform the family that because of her high-risk gene, the rest of the family members really need to be tested as well. I wasn't sure if they heard me, but sure enough, after the patient passed away, the 26-year-old daughter came looking for me one day. She's saying, I met you up on the floor when my mother was very sick, and now I'm here to get tested. I was able to tell the 26-year-old daughter that now she also carries the gene, but the hope now that goes with that is that she can pursue things like surgical intervention and close surveillance and not have to go through the same thing her mother went through. As nurses, we're face-to-face with people usually throughout their whole lifespan and many times in times of crisis. So the nurses are there when the new baby is born. Then the nurses are there when they come into the emergency room. The nurses are there whenever they get diagnosed with cancer. And then even to the end of life and to hospice and to palliative care. The nurses are there helping them, cross every bridge and hold their hand during those times of being afraid and fearful. And it's just really rewarding to be able to help people and to care about people.
I became a nurse because I had a son who had a terminal illness, and he was diagnosed at 1 year of age. Therein began my journey of nursing, to be able to take care of him. And unfortunately, he succumbed to his illness in 2001, the day after Christmas. So when I came to White Memorial, one of my patients who had a stillbirth at 33 weeks, she was admitted again with her pregnancy. She was 33 weeks. So I spent most of my time in her room listening to her, and then I finally asked her a hard question. What are you most afraid of? And I was captivated by her story, where her husband was super supportive and was with her through the whole journey of the loss of her child. But the minute she got home, all of the baby clothes she had purchased, the room that they had decorated was all gone. He got rid of it and he said, we're never to talk about this again. So she didn't speak about her loss for 5 years. So that's what inspired me to create an arena for women to be able to come and express themselves without judgment. So Little Angels is a program that we offer our community if they've had a loss, a pregnancy loss, a neonatal death. In 1988, Ronald Reagan made a proclamation for October the 15th to be the national day that we remember all of our babies that have died. So I said, well, it would be neat if we could sort of have a ceremony for our families where we can bring the community together, light a candle, have a moment of silence, and another opportunity for our people to heal.
Our little angel, Mia Serenity, please watch over us and know that even though we never met, we love you so very much. I look up in the sky and I see the shining stars. I look for the brightest star and I know that's where you are. You make beautiful things. You make beautiful things out of this.
Si Dios ha puesto esto en el corazón, entonces lo tienen que hacer. Porque quizás tú vas a ser la persona que vas a tocar a otra persona en su vida en el tiempo donde lo necesiten más.
Les aconsejo que sigan, no se rindan.
So, piénsale y échale las ganas porque sí es posible y al final no lo vas a arrepentir.
Ser enfermera no es solamente por el dinero, es para cuidar a nuestros pacientes, ayudarlos y ayudar a sus familias.
So, para ustedes, trabaja duro, trabaja adelante. No olvides que tú eres a veces el ángel para el paciente. Thank you. Gracias.